All right, today we're going to pull back the curtain on pharmacology. We're going to get into the real language behind the things we take. From what actually makes something a drug to the super fine line that separates a cure from a poison. Let's jump right in.
I mean, we've all been there, right? You pop a pill for a headache, maybe a fever, and after a little while, poof, you feel better. But what is actually going on in there? What's the magic? Well, it's not magic. It's pharmacology.
Think about something super common, like paracetamol. Pharmacology is the science that answers all the big questions. How does it know to lower your fever? What's your liver doing to it after you swallow it? How do we know how much is safe? And what happens if you take too much? It's the entire story of that little pill's journey through you.
So here's the official definition. Pharmacology is really a two-way street. It's not just about what the drug does to your body, it's also about what your body does back to the drug, how it chews it up, uses it, and gets rid of it. You got to understand both sides of that conversation.
Okay, so this whole process, this journey from an idea in a lab to something that helps a patient, it's not just one big leap. It's actually split into two huge fields, and knowing the difference is pretty important.
First up, you've got basic pharmacology. Just think of this as the how it works phase, happening purely in the lab. We're talking scientists working with cells in a petri dish, figuring out the absolute fundamentals. Like discovering that a molecule called propranolol can physically latch onto and block certain spots on isolated heart cells. It's the nitty-gritty science.
And then you have clinical pharmacology. This is where the rubber meets the road. That same propranolol is now being studied in actual people. And the questions totally change. It's no longer what does it do to a cell, but what does it do to a person? This is where we figure out the right dose, watch for side effects, and make sure it's safe and effective in the real world.
This chart really lays it all out nice and simple. In basic pharmacology, you're working with cells and animals to just understand the mechanism. But in clinical pharmacology, the focus shifts entirely to humans, and the goal is all about getting the best and safest outcome for the patient. The lab bench literally becomes the hospital bedside.
This one's my favorite because it really shows you the shift in thinking. The lab scientist asks, does it block the specific receptor? But the doctor asks, does it actually lower the patient's blood pressure? The lab sees cells beating slower in a dish. The clinic sees a patient who feels a little dizzy when they stand up. You see, the focus goes from the molecule to the person.
Now that whole lab phase has an official name, preclinical research. This is basic pharmacology doing its thing, using what are called in vitro tests, that means in glass, like a test tube, and in vivo tests, which means in a living thing. And the whole point, the one massive question they're trying to answer is this. Is this thing safe enough to even think about giving it to a human?
So let's say a substance makes it through all that preclinical work. What actually gives it the title of drug? Well, the definition is probably a lot broader than you'd expect.
So what's the official rule? What does a chemical have to do to get called a drug?
And here it is, straight from the World Health Organization. Now, the two key words you got to latch onto here are modify and explore. Notice it doesn't just say to treat diseases.
Let's break down that first word, modify. This just means changing a normal body function on purpose for a benefit. Things like hormonal contraceptives, they modify the reproductive system. Anesthesia modifies your nervous system so you're unconscious for surgery. Even vaccines count because they modify your immune system to train it. They're all drugs.
Now for that second part, exploring a system, this is so cool. Some drugs aren't meant to treat anything at all. They're tools. Think about the contrast dye they inject into you before a CT scan. That dye is technically a drug. Its job is to act like a biological flashlight, lighting up your blood vessels so the doctors can get a clear picture of what's going on inside.
Okay, this brings us to a really common mix-up. We use the words drug and medicine all the time, like they're the exact same thing. But in pharmacology? Nope. They are two very different concepts.
And honestly, this is the best analogy I've ever heard for it. Think of the drug as just the raw wheat flour. It's the core ingredient, it has the potential. But the medicine, that's the finished bread. It's the flour mixed with other things, baked, and made into something you can actually, eat safely.
So here's the more technical breakdown. A drug is just the pure chemical, what they call the active pharmaceutical ingredient, or API. But a medicine is that API plus a bunch of other stuff called excipients. These are the fillers, the binders, the coatings that turn that raw powder into a pill that holds together and that you can actually swallow.
So, here is the golden rule you gotta remember. Every single medicine has a drug inside it, but not every drug gets made into a medicine. A great example is heroin. It's a very powerful drug that causes a biological effect, but in most places it is absolutely not approved to be a medicine.
All right, for our last and maybe the most profound distinction of all, we've talked about drugs versus medicines. But what's the difference between a medicine and, well, a poison?
Well, first, let's just be super clear. Drugs are not food. Food is for energy and growth. Drugs are for a specific intervention, to treat or prevent something. They play by completely different rules.
And that brings us to this idea, a quote from the 1500s that is literally the foundation of toxicology. Paracelsus said, "All things are poison. Only the dose makes a thing not a poison." It's this idea that what makes something a cure or a poison isn't the substance itself, it's how much of it you use.
And this table just breaks that idea down perfectly. The same exact substance can be a healing medicine when you take it in a low, controlled, therapeutic dose, but it becomes a poison at a high, excessive dose. The only thing that really changes is the amount and the intent. It's all about balance.
So, as we wrap up, I want to leave you with this thought. Knowing now that every medicine you have contains a powerful drug, and that the only thing separating that drug from a poison is the dose, how does that change the way you look at that bottle of pills in your cabinet? It really makes you appreciate the incredible science that goes into getting that dose just perfectly right.